Hi everybody, today we are going to learn about ABG interpretation. What is ABG? ABG is arterial blood gas, and when you interpret ABG, you are analyzing patient oxygenation status, ventilation and acid-base balance. Oxygenation status by looking into PaO2 and SaO2 level, that is partial pressure of oxygen and the saturation of oxygen in the arterial blood. You can look into ventilation status by looking into the PaCO2, that is partial pressure of carbon dioxide levels, the acid-base balance by looking into pH and the bicarb level. Arterial blood gas is drawn from the arteries. It can be from radial, brachial or femoral artery. As a beginner, to interpret ABG, you have to know what is pH, PaCO2 and bicarb and the normal values of all these three, pH, PaCO2 and bicarb. What is pH? It is the acid-base balance, or whether the blood is acidotic or alkalotic. PaCO2 is the partial pressure of carbon dioxide and it is regulated by the respiratory system. The bicarb is the bicarb level in the arterial blood and it is regulated by kidneys. Now let's see the normal values. pH normal value is 7.35 to 7.45. PaCO2 is 35 to 45 and bicarb is 22 to 26. So to interpret ABG, you have to memorize these three values. So if you can memorize, you can interpret ABG easily. So once more, pH is 7.35 to 7.45. PaCO2 is 35 to 45 and bicarb is 22 to 26. pH indicates whether the blood is acidotic or alkalotic. PaCO2 indicates or regulated by the respiratory, whereas the bicarb is regulated by the kidneys. So if the pH drops less than 7.35, it is acid. The pH is greater than 7.45, it is base. Now I'm moving to bicarb. If bicarb less than 22, it is acid, and if it is greater than 26, it is base or alkalosis. So remember, pH and bicarb goes in the same direction. Now I'm going back to carbon dioxide. If carbon dioxide less than 35, it is base or alkalosis, and carbon dioxide greater than 45, it is acidosis. So memorize this, memorize what happens if it is low or higher. You can easily interpret ABG. You can always remember the word ROM, because respiratory carbon dioxide goes in opposite direction to pH, whereas the bicarb or metabolic or renal goes same direction as pH. Now let's interpret the ABG. pH of 7.36, PaCO2 of 43 and bicarb of 22. So pH is 7.35 to 7.45, it's normal. PaCO2 is 35 to 45, normal. Bicarb is 22 to 26, normal. So all these three values is normal. So this is an example of normal ABG. Now let's look into more ABGs. Okay, pH of 7.21, PaCO2 of 48 and bicarb 24. So pH 7.35 to 7.45, it's low. PaCO2 35 to 45, so it's high. And bicarb 22 to 26, it's normal. This is how you interpret ABG. Look all these three values, look whether it's low, high or normal. So pH is low. That means if pH is low, it's acid. So it's acidosis. Now you have to find out whether it's respiratory, whether the acidosis is due to carbon dioxide or bicarb. Look at the carbon dioxide level. The carbon dioxide is high. So if the carbon dioxide is high, it's acid. So you already got the answer. It's acid. So it's respiratory acidosis. Once you got the answer, look at the third value. Bicarb. Bicarb is normal. So when the third value is normal, there is no compensation. What is compensation? When something wrong goes with the body tries to fix it. So the PaCO2 goes into acidotic. So the third value changes so that body can fix the problem. Whereas in this ABG, the third value, the bicarb is normal. The body has not attempted to compensate it. So it's uncompensated. So the answer is respiratory acidosis uncompensated. So remember, uncompensation means the third value, whether it's CO2 or bicarb, it's normal. That means it's uncompensated. So the answer is respiratory acidosis. The third value is normal. When the third value is normal, it is uncompensated. Now let's look at the same ABG. I am changing the bicarb level to 27. pH of 7.21. PaCO2 of 48. And bicarb changed to 27. So pH 7.35 to 7.45, it's low. PaCO2, this is how you interpret. You look at all these three values, look whether it's normal, low or higher. PaCO2 35 to 45, so it's high. Bicarb 22 to 26, so it's high. When pH drops, it is acid. Now you have to find this acidosis is because of respiratory or metabolic. Look at the carbon dioxide. It is high. When carbon dioxide increases, it is high. So it's acid. So you got two acids. So you got the reason for acidosis. It is respiratory acidosis. Now look at the third value. The third value is abnormal. It has increased. That is, body tried to compensate it. But the pH is still abnormal, but the body has not succeeded to fix the pH. So it is partially compensated. So it's respiratory acidosis with partially compensated. So what is partially compensated? Nothing is normal. All three values is abnormal. Whereas compensated means the bicarb and the CO2 level is abnormal, but the body tried to fix the pH. That is fully compensated. So along with interpret ABG, you have to know what is uncompensated, partially compensated and fully compensated. Uncompensated means the third value is normal. Partial compensated is nothing is normal. Fully compensated means the pH is normal. Now let's see another ABG. pH of 7.42, PaCO2 of 32 and bicarb of 18. So pH 7.35 to 7.45, it's normal. PaCO2 35 to 45, it's low. Bicarb 22 to 26, so it's low. So the pH is normal, whereas other two values are out of range. So it is not a normal ABG. That means fully compensated ABG. Now you have to figure out whether the ABG is towards the acidosis or metabolic side. So the pH value is 7.35 to 7.45. Let's take the middle value 7.4. Anything less than 7.4 is towards the acidotic side, and anything greater than 7.4 is toward the alkalotic side. So it's 7.42, so the pH is towards the alkalotic side. PaCO2 is 32, it's low, so it's alkalosis. And bicarb is low, so it's acid. So you got the answer, alkalosis, alkalosis. So it's respiratory alkalosis with fully compensated. That means pH is normal. Okay, now let's look into another ABG. pH of 7.37, PaCO2 of 33 and bicarb of 17. Again, pH 7.35 to 7.45 normal. PaCO2 35 to 45, so it's low. Bicarb is 22 to 26, it's low. So this is not a normal ABG because your carbon dioxide and bicarb is out of range. So look more closely towards the pH. pH is normal, but whether it's towards the acid side or alkalotic side, remember 7.45 less, it's towards the acidotic, and greater than 7.4, it's towards the alkalotic side. So it's less than 7.4, so it's towards the acidotic side, so acid. Bicarb is low, so it's base. Sorry, carbon dioxide is low, so it's base. And bicarb is low, that means it's acid. So you already got two acid. It's metabolic acidosis where the pH is normal, so it is fully compensated. So remember, uncompensated means the third value will be normal because body has not tried to compensate. Third value is normal. Partially compensated means body is tried to fix but it's not successful, so nothing is normal. Partially compensated, nothing is normal because body has tried to compensate but it's not successful. Fully compensated means it's successful, that is pH is normal even though the other two values, the bicarb and CO2 is out of range. Now let's look at another ABG. ABG pH of 7.27, PaCO2 of 33 and bicarb of 17. So pH 7.35 to 7.45, it's low. PaCO2 35 to 45, so it's low. Bicarb 22 to 26, it's low. When pH drops, it is acid. When carbon dioxide drops, it is base. When bicarb drops, it is acid. So you got the answer, acid. It's metabolic, it's CO2. So it's metabolic acidosis. All three values are not normal, so it's partially compensated. I'm just going back to uncompensated, partial, fully compensated. Uncompensated, the third value is normal. Partial means body tried to compensate but it's not successful. That means everything is abnormal, nothing is normal. Fully compensated means pH is normal. So hopefully you understood the interpretation of ABG. I'm just going through quick tips. Remember Rome, respiratory goes in opposite direction to pH, whereas metabolic goes in equal direction. No, remember the normal values, and uncompensated, partial and compensated. Uncompensated means third value is normal, partially nothing is normal, whereas fully compensated means pH is normal. And remember the normal values, pH of 7.35 to 7.45, PaCO2 is 35 to 45, and bicarb is 22 to 26. If pH drops, it is acid. pH increases, it is base. Same like bicarb. Remember Rho, metabolic equal. Bicarb drops, it is acid. Bicarb increases, it is base or alkalosis. Whereas in carbon dioxide, Rho, respiratory, opposite. It goes in opposite direction. If carbon dioxide drops, it is base, whereas carbon dioxide increases, it is acid.